First, I want to say some thank yous to the residents of River Heights, to the staff who work in my office, to Rana Bokhari, Manitoba Liberal leader, and to those who support from around the province the Manitoba Liberal Party. Now I'll respond to the throne speech. My overall impression is that the media are right. The Premier must have spent most of the last 5 months battling internal turmoil within his caucus because there's little of the planning I would usually expect in the throne speech. A throne speech is a chance to talk about the big issues, the challenges, and the opportunities. A throne speech should talk about the challenges faced by the province and what solutions the government will implement to meet these challenges. As in other areas, a good plan depends on, first, a good understanding of the problem, demonstrated in an articulate definition of the issue. In the case of the NDP throne speech, there is a poor definition of the problems and then a poor outline of the plan to address these problems. I will begin by focusing on a report of the Broadbent Institute. This report looked at the well-being of Canadians across Canada. Sadly, Manitoban social well-being was rated the lowest of all the provinces. There were specific reasons for this. Today's NDP has failed to recognize the importance of social well-being and the importance of issues which were raised by the Broadbent Institute. As I go through my response to this speech from the throne, I will mention aspects of the Broadbent Institute study of social well-being and address the areas where Manitoba came up short. First, education. The throne speech starts with a discussion of education, but sadly the throne speech doesn't address one of the most important issues of today, the fact that our students are doing poorly when assessed in comparison to other provinces. Let's take a look at the results of the recent Pan-Canadian assessment of mathematics, reading, and science. This is an assessment done by the Councillors of Ministers of Education Canada, of which Manitoba's Minister of Education is a member. The results for Manitoba under today's NDP were abysmal. Among all provinces, Manitoba was dead last in science, reading, and mathematics. The impact is across the spectrum of students, with more Manitoba students having low scores and few Manitoba students having high scores. The results are so bad, they threaten to pull our students and our province backwards and to cause major difficulties in several areas for many years to come. The issue here is the quality of the education our children are receiving. This is an issue that affects children and their future, and it affects our families and communities because the future of our families and our communities depends on our children and how well they do. It is a shortcoming for Manitoba that was highlighted in the Broadbent Institute study of social well-being. It should have been addressed in the throne speech. It was not. Let us examine the results a little closer. Manitoba was not just last in science. We were 35 points lower than the Canadian average and 40 points lower than Alberta. Manitoba was not just last in reading. Manitoba was 39 points below the Canadian average and 55 points below Ontario. Manitoba was not just last in math. We were 36 points below the Canadian average and 56 points below Quebec. Manitoba was not just last in science learning overall. Manitoba was last in physical and earth sciences and second last in life sciences. Manitoba was last in scientific inquiry and problem solving and second last in scientific reasoning. Manitoba wasn't even close to the Canadian average in any of these areas and was 56 points behind Alberta in scientific inquiry. Mr. Speaker, the tombstone of the NDP will read, through poor management and terrible implementation, the NDP government of 1999 to 2015 failed the children of our province so badly that they fell behind every other province in Canada in reading, mathematics, and science. Even the Free Press highlighted this in an editorial, saying that the approach of today's NDP, high cost and low outcome, isn't acceptable. The Free Press goes on to say that Manitoba's NDP has a nasty habit of pandering to voters, as opposed to promoting innovations that might make services better and cheaper. Sadly, in the throne speech, not only do we not see an acknowledgement that the quality of education and the outcomes of our students are important, but we do not see the needed commitment to look at how we improve education while stemming the rise in costs. To be fair, the throne speech did make a positive step in addressing student debt, saying it would in next year's budget eliminate the interest on student loans. But we still don't know whether this will be for all students or just some students, and when it will actually start. It must also be said that the funding pressures on universities and the recent announcement that the University of Manitoba must face deep budget cuts emphasizes the fact that the NDP broke their multi-year funding commitment to our universities and instituted cutbacks in the last two budgets, which are partly to blame for this problem. Second, healthcare. As in education, the section in the throne speech on health fails to focus on the most critical questions which exist in healthcare today for Manitoba. Recently, a report released by the Canadian Institute for Health Information on September 18th showed that Winnipeg's hospitals had very long wait times in their emergency rooms. The longest of these was the Grace Hospital, where the 90th percentile of waits was 9.1 hours. Dr. Howard Owens, a co-author of the Canadian Association of Emergency Physicians' Statement on Emergency Departments, said 9 hours is really a very troubling figure. The idea of actually waiting 9 hours in an emergency room is disturbing. The throne speech doesn't recognize the extent of the problem. And though the throne speech announces funding for redevelopment of the Grace Hospital, including a new emergency room, we all know what happened after the redevelopment of the Health Sciences Centre emergency room. Brian Sinclair died waiting 34 hours to get help. It's more than just building structures. It's about improving operating procedures as well. But the issue of the emergency rooms is larger than this. Through a Freedom of Information request, we found that there were over 750 days in 23 Manitoba hospitals outside Winnipeg where the emergency room was closed and not available to those who had an emergency. This also was not recognized in the throne speech, and no plan at all was mentioned to address this problem. And there are other critical health issues which are inadequately dealt with. Mental health is one. Except for a brief reference to post-traumatic stress disorder, mental or brain health is not mentioned. This in spite of the fact that the Broadbent Institute highlighted the fact that Manitobans had the lowest self-perceived mental health of any province. It's an important issue for Manitobans, and it should have been addressed in the throne speech. It was not. Manitoba Liberals have been concerned with the mental health, brain health of Manitobans for some time. Indeed, recently we announced the first plank in our platform to build a healthy Manitoba, to increase access to psychological services in our province. This has received very positive comments because people know that access to psychological services is critical to improve mental and brain health and well-being. In contrast to our prioritizing mental and brain health, the NDP throne speech relegated mental and brain health to the back burner. Indeed, today's NDP have neglected the importance of psychologists in healthcare for 15 years, to the point that Manitoba trails the other provinces in Canada in the number of psychologists per capita. Liberals have put an emphasis on better access to psychological services in order to address the mental health needs of Manitobans. And because we see it's critical to address the mental and brain health needs before people end up in crisis and have to go to an emergency room or a crisis response center. But there is more in health. Since 1992, Manitoba has had an epidemic of diabetes. When the NDP came to power, the epidemic had progressed to the point that just over 50,000 Manitobans had diabetes. Today, after 15 years of NDP government, the epidemic continues at an accelerated pace, as we now have more than 100,000 Manitobans with diabetes. I've talked about the lack of action by today's NDP on many occasions in this legislature, and yet this year diabetes was not even mentioned in the throne speech. The same is true for FASD, another major problem in our province. And yet today's NDP have done all too little to prevent FASD and to decrease its devastating effects. Infrastructure. In last year's throne speech, the government said every dollar raised from the new point of PST will be fully dedicated to new investments in core infrastructure over and above existing spending levels. As we are finding out, the reality is somewhat different. In their first report on their infrastructure spending under this plan, In September, the provincial government reported that it had taken $190 million from Manitobans' pockets in the first year, 2013-2014, of the implementation of the increase in the PST from 7 to 8%. They also reported that they'd spent $115 million on core infrastructure, leaving a shortfall of $75 million. From government records, this $75 million was spent on items other than infrastructure. But more than this, we've now confirmed that much of the money used for the $115 million of core infrastructure spending was actually not from the PST increase, but was borrowed money. This borrowed money is evidence that the government is not doing what it said it was going to do: spend every dollar of PST money on core infrastructure. It's also building up our provincial debt so that our debt is climbing higher and higher, leaving a legacy of debt for future generations. There's another important aspect of the provincial approach to infrastructure spending. For many, many years, the City of Winnipeg and municipalities throughout our province have called for a new deal in which the province provides much better support to municipalities to address the infrastructure needs. Manitoba Liberals have shown in an announcement in recent weeks that Liberals are prepared to address this issue, while the NDP have shown over 15 years that they are not going to address it at all. Child and Family Services. Manitoba's child and family service system is a very important area of concern. Yet here again, there was a lack of focus on the part of the government in the throne speech. The focus needs to be on much better support of families in order to reduce the number of children in care. Year after year, the number of children in care has been going up and up and up under this NDP government. The answer to why this is happening is well documented in a report we released a year ago. Sadly, in her recent response to the ongoing situation of children in care being housed in hotels, the Minister of Family Services has basically brought forward a repeat of the approach used from a time before when there was public attention to the fact that her government was housing children in hotels. It is a response to increase the capacity, not to address the real reason why there are children in hotels, that the government is operating a system which is taking far too many children into care in the first place. Indeed, not only this, but as was reported by one family last week, there are grave concerns that a child may be less safe in CFS care at times than at the home. I have spent a great deal of time talking with people within the system and people affected by the system. In the last year, as an example, I visited the Nisitchawayashik Cree Nation and Family and Community Wellness Center. I visited there 3 times in order to better understand how they're managing child and family services. They have found an approach which brings together a variety of services in one place, under one executive director, and with a common purpose of helping families and supporting children. They have, as one can see by looking at the recent report of Family Services, reduced the number of children in care by 18%. And they've done this by treating families with respect and by helping families to address the challenges they face, not by immediately apprehending children from all the families that need their help. Think of it, Mr. Speaker. If the whole system had reduced its number of children in care by 18%, then last year the number of children in care would have decreased to just over 8,000 instead of increasing to over 10,000, as actually happened. This government continues to fail children like Tina Fontaine, who was exposed to drugs and prostitution in the hotel she was placed in. This government has not in 15 years developed the capacity to change the misguided direction it's been going in and to improve the lives of children and families, instead of causing the breakup of more families and having more children in care. And in the throne speech, there was no clear plan to change. It is now almost a year after the Phoenix Sinclair inquiry report, and very little appears to have changed. It is unacceptable. The economy. The government talks about the performance of the economy. One of the most important measures of how the economy is doing is whether we are seeing people leave for other provinces or whether we are seeing people from other provinces come to Manitoba. On balance, in the 15 years of today's NDP government, year after year, we have people leaving. That is, there is a net loss of Manitobans to other provinces. This loss has been tragic in many ways, most particularly because it says that on a comparison basis, people in Manitoba see greater opportunity elsewhere in Canada and not enough opportunity here in Manitoba. Together with the loss of people, our relative status on a critical economic area, manufacturing, has changed. While Saskatchewan has been doing well in manufacturing, we cannot make the same claim. The result has been that Saskatchewan has now overtaken Manitoba in terms of manufacturing output. In essence, the NDP have created a situation where those interested in manufacturing are going elsewhere to build or expand their business. Today's NDP have frankly just been incompetent in this respect. The throne speech should have had a real plan to address our lack of progress in manufacturing. Why it was not there is hard to fathom, but the plan was not there. Poverty. A Campaign 2000 report this week exposed a devastating crisis in Manitoba. It showed that we have the highest rate of child poverty of any province in Canada, and that we have the highest per capita food bank use of any province in Canada. In spite of, and many would say because of, today's NDP, over the last 15 years, there has been, as Jim Silver has said, the persistence in Manitoba of a deep, complex, and damaging poverty. In 2008, this government brought forward its all-aboard strategy to address poverty. But as Sid Frankel has shown, and the recent Campaign 2000 report makes clear, it has been ineffective. In a lengthy discourse on the all-aboard strategy, Dr. Frankel describes the strategy as misguided and says that it's not sufficiently articulated for implementation and that it has not been effective. The throne speech doesn't recognize the depth of this problem or the failures of the government, let alone set forth what is needed, a far better plan and implementation to address poverty in Manitoba. Flood prevention. Preventing floods, as we all know, is vital in Manitoba. One of the critical areas which was identified in the report following the 1997 flood was land management. That is, water management on the land. During the flood of 1997 in southwestern Manitoba, it became evident that this was particularly critical in southwestern Manitoba. In spite of this, today's NDP did little, even though it was apparent at that time that a surface water management plan was needed. The lack of an NDP surface water management plan was very evident in the flood of 20, and in various studies which have shown that in this area, water plays in the severity of the flood. Nevertheless, the NDP failed to act, and in the fall of 2011 there was extensive drainage in southwestern Manitoba. The area was set up then and in succeeding years since 2011 for increasing severe flooding. And guess what? It happened in 2014 with a severe flood. And still, now 3 years after the flood of 2011, the NDP continued to hesitate to put a surface water management plan in place. We have heard this year that the NDP may act after 15 years of delay. The throne speech even says so, but we have 6 more days in this sitting and have not yet seen a bill to address it. Liberals saw this as so critical we called for the legislature to resume in September this year to deal with the surface water management plan and other time-sensitive and critical issues. The NDP delayed, as they have so often in the past. And so now we are here in November, and there is still no surface water management strategy in place. Such ongoing delays are neither surprising nor impressive, but they sure are disappointing. The throne speech calls for efforts to address flood prevention for people around Lake Manitoba and Lake St. Martin. Here again, there are delays and delays and delays. Indeed, hundreds of people from the communities of Little Saskatchewan, Lake St. Martin, and Dauphin River remain out of their homes partway through their 4th year after the flood that displaced them. It was a flood, we must remember, that this government actually created by sending water through the Portage Diversion and raising the levels of Lake Manitoba and Lake St. Martin. And yet today there is still no clear indication of when people will be able to return to their homes and their home communities. Lake Winnipeg. The late and delaying NDP are late on the hearings of the regulation of Lake Winnipeg, which have been delayed until 2015. This is another sign that Lake Winnipeg is just not a priority for this government. While problems with algal blooms on Lake Winnipeg continued again this year, a new problem also emerged: zebra mussels. The arrival of zebra mussels signals a failure of the activities to prevent this invasion and its devastating effects on Lake Winnipeg. With the presence of zebra mussels on the lake, the plan now needs to focus on species which are related to zebra mussels. At a meeting this summer, Robert Christensen emphasized the importance of preventing a similar invasion from other similar species. 2, mitigation of the effects of the zebra mussels and suppression of their growth in Lake Winnipeg. And 3, perhaps most important of all, adequate measures to prevent the spread of the zebra mussels to other lakes in Manitoba and outside of Lake Winnipeg. There are many, many lakes, probably somewhere around 100,000 lakes, which are at risk. And yet this government, when it knew it needed to act to prevent the spread of zebra mussels to other lakes, and it knew that current legislation was not good enough, has failed to act. I called for the legislature to sit in September to deal with this so there could be prompt action, and we could have action in place by the time that boats were being moved around as the ice came on this fall. But instead, the NDP delayed and delayed and delayed, and here we are in late November, and the bill still has not been brought forward. Where is it? Why the continuing delay? Manitobans need to know. Childcare and early childhood education.